Hello and very good evening, everyone. This is Dr. Ashali from USV. A very warm welcome to all the delegates for this distinctive session on Future Plus Emotional Intelligence for Doctors. Let me start by asking, have you ever regretted saying the wrong thing in the heat of the moment, or wished that you could quickly diffuse a tense situation or could get a better sense of how others viewed you? Many of the challenges of healthcare stem from working in a highly complex and emotionally demanding environment. The ability to manage yourself and your relationships with others is an invaluable skill that the healthcare leaders must possess. With this, I would like to invite a very perceptive and discerning healthcare leader himself, present with us today, Dr. A.G. Unnikrishnan, sir. Dr. A.G. Unnikrishnan, sir, is an endocrinologist and CEO of Chelaram Diabetes Institute, Pune, a leading diabetes institute in India and an International Diabetes Federation certified center for education and excellence in diabetes care. He heads the clinical care, research, education, and also oversees a philanthropic rural diabetes care at the institute. And then also heads the institute's e-learning academy. He has published the largest multi-center study of the subjects with pancreatitis and pancreatic diabetes worldwide, in addition to his more than 200 PubMed indexed publications. Dr. Unni has received the Jacob Memorial Prize for the Best Patient Care during his MD in CMC Vellore. He has also received 10 awards and oration in the last 9 years, including the DTech Award for Excellence in Diabetes and Technology and the VC Matthew Roy Oration in July 2022. He is the editor-in-chief of the Journal of Chronicles of Diabetes Research and Practice. He is also on the editorial board member of multiple journals like Indian Journal of Endocrinology and Metabolism and Journal of Thyroid Research and Practice. It's great to have you here with us today, sir. I welcome you on behalf of Team USV and over to you for the further proceedings.
Thank you. It's a pleasure being here. Let me just share the slides. Future Plus series and season 4. And this episode is titled Emotional Intelligence for Doctors. So this is going to be the topic, emotional intelligence, and the Future Plus series looks at how doctors can change according to a rapidly changing environment of clinical practice, whether it is digital diabetology, whether it is work-life balance, whether it is academics or research or scientific writing. So all these things covered in the various modules and sessions that we finished. So like a popular OTT, this is a very popular program and thousands of doctors have attended these programs. One of the reasons for the success is the audience is treated to top-class people sharing their personal insights. And today we have an audience participant also with us. These are the modules covered here now. And this is, in season 4, we finished the art of public speaking, and now we have emotional intelligence. So my task is just to introduce the scope of the program, how to improve our emotional intelligence competency, handling situations, and how to incorporate it into the practice. We have excellent speakers and excellent experts. We have Dr. Kaushik Pandit, who is the Vice President of the Endocrine Society of India, a close friend, has received several awards, including the prestigious Albert Reynolds Fellowship from EASD, has fellowship from the American College of Endocrinology, fellow of the Royal College of Physicians at Edinburgh and Glasgow. Also a consultant, a very popular doctor in Calcutta, a research scientist, several publications. Next, we have Dr. Prasun Deb, a very inspiring, personally I found Dr. Prasun Deb very inspiring, overcoming personal challenges to shine brighter and brighter as the days go by. He's, of course, did his MBBS MD from Kanpur and his DM from Sanjay Gandhi PGI Lucknow, and also has been in various academic positions and is also the senior consultant at the Krishna Institute of Medical Science. He practices in Hyderabad, very elegant speaker, like Dr. Kaushik and like Dr. Kaushik is a Bengali. Dr. Kaushik is an academic scholar, and Dr. Prasun Deb is an inspiring personality with a wonderful sense of humor, which I always like to listen to. So both elegant, excellent speakers. And the third speaker is an equally important and rising, I should say, risen star or continuously rising star in endocrinology. She's Dr. Chitra Selvan, faculty at the MS Ramaiah Medical College, a distinguished endocrinologist herself, did a DM from Kolkata. She's a member of the National Academy of Medical Sciences. She won the A.V. Gandhi Award for Excellence, the RSSDI Young Investigator Award. She has more than 50 publications, and she's interested in women's health, polycystic ovarian disease, menopause, has been a very important proponent of the importance of language in diabetes management and also psychosocial aspects of chronic care. A very erudite and lucid speaker. It's a pleasure to have all the three speakers here. And today, for the first time, we have a new participant who is from our audience desk. This is Dr. Prathyusha Narella, and Dr. Prathyusha is a senior consultant physician, diabetes and lifestyle medicine specialist at MedPlus Health Services in Hyderabad, has been a consultant physician and diabetes specialist at the Apollo Group, has been a faculty for the CCBDM PHFI course, has been an active advocate for diabetes care, spreading awareness on diabetes and holistic health through many channels, including public awareness channel, and has been a very silent, low-profile contributor to the content of the various seasons of the Future Plus program, which is a successful program because it doesn't talk about theory and about genetics or molecular biology or randomized controlled trial. It deals with situations which we doctors face in our life, day-to-day life and practice. So before I stop sharing the screen, let me ask you, in your opinion, how important is emotional intelligence important in your daily routine practice? Option 1, always important. Option 2, often important. Option 3, sometimes important. Option 4, never important. And while we are waiting for the answer, let me go ahead and ask one of the questions to Dr. Chitra. Dr. Chitra, so considering the emotional nuances involved, how do you ensure effective communication and understanding? As doctors, we deal with people from diverse backgrounds. How do you adapt as a doctor to their needs and to their requirements?
Thank you so much for hosting this unique, important topic, Dr. Unni. And I think for the doctors who are still mulling about the question, I think caring about the emotional component in a clinical consultation is not just important for our patients, it's equally important for us. Imagine if you've had like 5 bad interactions with your patients, you go back home with a bad taste in your mouth, you go back home angry, upset, and in the end of the day, that does translate as stress and take effect on us. So there is a selfish component to this as well, because all communication involves 2 parties, and everything that we give in, we take back as well. I think that's important for us to understand. And we should become more comfortable with understanding that we are moving away from the authoritative kind of consultation plan to a more shared decision making, which means that we should be okay with taking in what your patient has to say about their needs and requirements for their consultation. So that is an important bit. And I think no bigger situation can teach you that than, let's say, when you're trying to parent your child, especially a teenager. So you have to respect their boundaries and will, but you also need to put your case across in a meaningful, respectful way. And I think interactions with patients are also the same way, irrespective of socio-cultural backgrounds, I would say. So I think we should be more inclusive in the way that many people ask me, so how do we start that? So I think it starts by asking, what do you think are the reasons your HbA1cs are high this time? What do you think we should do? What areas do you need my help? Would you be open to discussing insulin today? I think those kind of questions bring their opinions into the conversation so that we can plan and prep ahead, where you're giving equal weightage to what they're saying and not speaking from a place of power and saying, I'm the endocrinologist, I'm the diabetologist, I know everything about diabetes. This was never taught in medical school. This is also something which we never reflect upon as consultants. But I think as all of us continue our individual journeys of growth, as Dr. Prathyusha told us, we should be beginning to apply the same rules with patients. Just like parenting has changed over the last few decades, I think consultation also is bound to change. And that's why I think we should care about this topic, Dr. Unni.
So I really like the connection you made between parenting and clinical care, because in many ways, when a patient comes to a doctor, maybe we are not supposed to be parents, but you end up sometimes adapting because different patients have different requirements. Some patients would like to look upon you as a sibling. Some of you like look upon you as a parent or an uncle or an aunt. Of course, I don't enjoy being called uncle anymore. When I was young, I used to like to be called uncle. Now I'm old, I don't want to be called uncle. And of course, some parents, some of the older people even look upon you as their son or daughter. So with diverse people, you'll have to harness your skills in a diverse way so that the patient is comfortable within the room where you practice. On that note, let me now ask the USV team whether we can have the poll answers. So do you have the answers, Dr. Oshley? So Dr. Prasun Deb, now that we're looking at these answers, everybody says emotional intelligence is always required. But according to you, drawing upon your personal experience, and I think you have, if you have emotional intelligence for sure, what does emotional intelligence mean to you as a person and as a doctor? And why should this topic be very important today? Your thoughts.
Thanks, Dr. Unni, and thanks to have me in this meeting. Not very far ago, this entire concept was called emotional quotient, as differentiated from intelligence quotient. We used to talk about IQ and EQ, and people used to say that IQ takes you to that position that you're aiming for, and EQ keeps you there, because unless you have a proper EQ, it's very difficult to sustain what you have done. Now, the difference between IQ and EQ is IQ is understanding your subjects. If you are a doctor, IQ helps you know your subject. EQ helps you to understand patients, understand people. And this is a very, very important aspect of, especially in our kind of patients, because most of them are chronic illnesses patients. They have diabetes for life, and you would like to think that you will be their doctor for life. And so this is not a one-off thing. I'm sure it is equally important for all doctors. But say if we were gallbladder surgeons, all you need to do is do one gallbladder surgery and probably you'll not see the patient again. But diabetes, you need to be seeing this patient over and over for the rest of his life. And so it is very important that the EQ factors in your day-to-day activities. And this is the reason why we need to improve on our EQ skills. And also, this is the reason why we are having this doctors meeting where we are discussing this. And as the doctors have already pointed out, a good 70% feel that you need to do it all the time. And I agree, because it's not that it's an EQ thing, is not something that you switch on and switch off. You do not say, okay, now it's 10, I start my OP and I have become emotionally very stable. And then it's 5, I switch it off and I become rude and cantankerous. That won't work. You need to be EQ compliant all the time. Unless you do that, people will see through you. It cannot be a truthful thing. You are play acting, and play acting does not work in EQ. So it has to be all the time. especially when you are dealing with patients, but not always, as Dr. Chitra has pointed out, that you take this EQ back home and your family members can actually bear the brunt of having a bad day if your EQ has not been, up to mark. You have had fights, you had unpleasant situations at work, and you reflect that at home. So the answer is yes, you need to have a good EQ all the time, especially for doctors who treat chronic illnesses. I think that's my answer. Yeah.
I think very well said. So when you talked about this coming back home, I'm reminded of one of my colleagues who calls this an air hostess syndrome. Because the air hostess has to be pleasant, pleasant, pleasant to everybody on the flight. But when the air hostess goes home, the air hostess has to release that anger somewhere, so they have to release it. And even today, I remember my wife told me, Unni, once you finish this meeting, make sure that you have good food and you have a dessert and then you come home. Don't come home hungry, because once you come home hungry, then everybody is affected by your mood. So I think it's about making sure you do the things so that you are aware of what is happening around us. Once you are aware of what is happening, even in an airport, if you sit, I know Dr. Chitra Selvan is at the airport. She's going to catch a flight right now. When I sit in the airport, sometimes I think somebody is staring at me. And when I look, I really find somebody staring at me. Then I think, how did I know somebody is staring? That is a sixth sense, some sort of intuition you cultivate. And this is also very important in practice. When a patient is in your room, you will have to be very aware of what the patient is thinking. And that's not probably where now we'll have to ask Dr. Kaushik Pandit his views about this emotional intelligence. How to be aware and how to be emotionally intelligent. Is it something that we are born with, or is it acquired? If it's acquired, how do we acquire such a skill? I know you are emotionally intelligent, because once when I came to Calcutta, you gave me I spoke at a meeting and you gave me a wonderful book which really resonated with me. And I thought, oh, how did Dr. Kaushik know that I'm going to like this book? So I really want to ask you, what are your thoughts?
Sorry. Thank you, Unni, for your comments. And I indeed feel very comfortable in the company of my friends like you, Prasun and Chitra. Both Prasun and Chitra has got a Bengali connection too. Yes. Chitra having had her DM from Kolkata. So I thought her as a half Bengali. Anyway, so far as emotional intelligence is concerned, it is something that we really need to acquire. It's not something innate. And it's hard fact, it's true that in medical schools or colleges, we call it colleges here, elsewhere they call it medical school, the teaching revolves around the basics of biology, biochemistry, or biophysics. In fact, we are supposed to know in depth in all its minutiae about them. However, there is a lacuna in the understanding that all these are involving a living human being, just like oneself. And that is, in fact, a great big paradox. And we tend to forget many a times that, like me and you, the person concerned, that is patient, he or she, has a mind of his or her own and would accept or reject or react to the information shared. We do have sensory organs, of which we really need to know in detail, of course. But what that sensation does to the psyche of the person concerned is not really appreciated or given a passing thought. In fact, it is very unlikely that you would come across a question in an MBBS exam that how do you inform a patient of his or her relatives about a diagnosis of a grave disease? Not Graves' disease, which fortunately is not a grave disease in the hand of a endocrinologist who can handle it with elan and give a good deal of relief to the person. Jokes apart, so thereby there exists a vacuum in the undergraduate medical curriculum, and we are blissfully ignorant of the existence of it, or maybe behaving just like a proverbial ostrich in the sand. It is important these days to make our medical students of these days be made aware of these and train them to give due credence to this very valuable concept of emotional intelligence. The notion of emotional intelligence, it first gained momentum with a person known as Daniel Goleman, a psychologist and a best-selling author, who a few decades ago gave the 5 components of emotional intelligence. The first is called self-awareness, where self-awareness refers to the capacity to recognize and understand emotions and to have a sense of how one's actions, moods, and emotions, of others take effect. Then second, you have got self-regulation. This aspect of emotional intelligence involves the appropriate expression of emotion, self-regulation, including being flexible, coping with the change, and managing conflict. The third is social skills. This component of EI refers to the interacting well with other people. It involves applying an understanding of the emotions of yourselves and others to communicate and interact with others on a day-to-day basis. The fourth is empathy, a very important one. Empathy refers to being able to understand how others are feeling. This component of EI enables an individual to respond appropriately to other people based on recognizing their emotions. And the fifth one and the last one is motivation. Motivation, when considered as a component of EI, refers to intrinsic motivation. And intrinsic motivation means that an individual is driven to meet personal needs and goals rather than being motivated by external rewards such as money, fame, and recognition. So EI is actually a cluster of skills and competencies. So I'll stop here and would invite others to comment on these issues as well.
So we have a quick poll now. We'll have a quick poll and then I'll ask Dr. Chitra and Dr. Prasun Deb to comment. And this is poll question number 2. So could we have the poll question number 2 put up? And this time the question is, how difficult is it to connect with your patient at an emotional level to know his or her condition better? We've all agreed that it's very important, but now the question is, how difficult is it? 1, very difficult. 2, difficult. 3, somewhat easy. 4, easy. So while we are waiting for the answer, because Dr. Chitra, I understand, has to board a flight also, and I think her emotional intelligence needs to be preserved for us for this meeting, because now they'll announce at the boarding gate, please come, board, the flight is boarding. So before that emotional attack on her, let us ask her a question. So in day-to-day practice, when you have a team of colleagues and you see patients and you have a reception, colleagues, you have junior doctors, senior doctors, how does this emotional intelligence, help us to help a doctor to succeed? Because there are young doctors, senior doctors all listening. So how would you tell them from your life how to succeed? How it will help you succeed? Yes. I told you. Yes, go ahead.
Sorry, there was a... I'm so sorry.
No problem. No problem. But if you're not able to continue, I'll ask it to Dr. Prasun Deb. No problem. We are all friends. Go ahead.
Okay, maybe in the gap, I'll try and answer before the next announcement. So the 2 important points highlighted were that these are skills that we can improve upon, we can learn. And medical education is waking up to this. And now there is a mandatory training course for all people joining MBBS, that they be trained on communication skills. And we're extremely happy to be part of the team which is building these communication skills. Even the DM endocrinology program in our institute has a communication course run. Over to Dr. Prasun.
Yeah. Okay.
Yes.
So the management trainees for a long time have been exposed to this. They called it soft skills. Before they had this word EQ and IQ in their lexicon, they used to call this soft skills. Things that you do not need for your core competence areas, but you need to master so that you can do your profession or you can discharge your profession better. This is unfortunately something that we have never been formally trained at. So this is something that we learn on the job. I'm sure most of us have started learning it when we were medical students. The first prickly thing that we learn is how to give a bad information or a bad diagnosis to a group of people. And this is something we have learned fairly early at an age where most of the professional people did not even interact. We were already giving bad news to people. And this is something that you really need to master. There's a small story of Akbar and Birbal where there was this Jyotish who had come to see Akbar, and he looked at his hand and told the emperor, "Oh, you're going to have a very sad life. All your relatives are going to die in front of you." And Akbar was very, very unhappy. So he said, "You look at my hand again and you give me a better information tomorrow." So Birbal takes him aside and he says, "Why don't you change it?" So this guy says, "No, I'm a truthful person. He is going to see his relatives die in front of him." So Birbal says, "Tomorrow you go to the emperor and say that you are going to be the longest living among your relatives." Same information, but you place it, you package it differently. So this is something that we all in our own way have mastered and sort of honed our skills, so to speak. And this is something that we need to now formally tell our juniors, and that we are already doing. The most of the training programs, they now have a soft skill training. And I'm sorry, I'll just add one more small point and then we'll
Go
go
ahead,
back to
please go
Dr.
ahead.
Chitra before she boards the flight. The question was, is it easy or is it difficult? It is as easy as listening to people. Now, the difference of is that you have to really listen. It's not just hearing. You have to listen. If a patient is being rude, and I find that this is especially true for elderly matriarchs of families, or really, really, an old person who thinks that people don't look after him too much. Those really cantankerous, really abusive people, it's basically a cry for help. So what you need to do is you need to really listen to people, and then you'll find that the responding becomes easier. Just my take on that. I'll ask
So
Dr.
that's
Chitra to come
so
Can
back
I?
on
Dr.
this.
Chitra, your views. Yes, please go ahead.
That's a very important point, Dr. Prasun. And I think in my journey of trying to become more aware of my own emotional state, my understanding of the other person's emotional state has increased. And that journey, I think we all start at some point. And it's easier when you are paying attention to how you're feeling. And I think doctors are particularly not so great of getting in touch with whether we are tired, whether we are exhausted, whether we are being too hard on ourselves, whether we are judging ourselves too hard. I think that's also something to reflect on. But I think the basic principle is that when somebody walks into your consultation room, whether we like to believe it or not, they are coming from a place of fear, and they are feeling vulnerable in that interaction. So whether we want to believe it or not, there is a power hierarchy in that relationship during that consult for that 15 minutes. And we are the ones in power. So thereby the onus is on us to do better and to do the right thing. And like Dr. Prasun said, it begins by paying attention to the way they are sitting, whether they are leaning back or not, are their hands clasped, their body language. There are so many cues which come out. But it's very obvious that almost everybody, even the angry one, even the angry patient, the patient who's yelling at your receptionist, they're probably the most scared. Hospitals aren't nice places. Hospitals aren't safe places. So your triggers are ringing from all ends. And thereby, the most important thing that we all should do is to allay fears. I think that's the simplest way to get this EQ implementation work beginning.
Yep.
Thank you. And now we'll have the answers to the poll. So, Dr. Oshley, can we have the answers? So, my take on this, whether it is very difficult. So, most people say it's difficult. Nobody says it's very difficult, but it is difficult. Some people say it's easy. And I suppose it depends on the situation, For young people beginning their practice, it might be a little difficult. For very senior doctors, it might be easy. But at the same time, it also depends on your mood that day. That's very important. Some days you are in a good mood and this emotional intelligence is so effortless that, it just flows through. Some days you're having a hard time for many reasons. And then, you have to really put in an effort to gauge what the patient is thinking. But on the days, if you are able to put in that effort, it can be very rewarding. Just to give you an example, it's been now 11 years since I came to, it's the 11th year since I moved to Pune. But when I moved about 10, 11 years ago, a patient came to me, a very elderly lady. She said, "Doctor, you are new here?" I said, "I'm new." "Are you a cobra?" So I said, "Cobra? I don't know what is cobra." So she said, "Cobra means Konkanastha Brahmin. You look like a cobra, a Konkanastha Brahmin. So are you a Konkanastha Brahmin?" So I said, "No, I'm not." So there was a very uncomfortable silence there. Because then I realized, like Dr. Chitra said, the onus is on us to make the patient comfortable. So, the room went a little silent. It was an awkward silence. So I said, "I'm not a Konkanastha Brahmin, but if you want, I can be one for you." So immediately she laughed, and then, everybody laughed, and the whole situation was, back to pleasantries again. So on a good day, when I'm having a good day, I'm able to have those, my mind is aware of my surroundings. I'm thinking what the patient is thinking, and it just flows through. But sometimes when we're having a tough day, we'll have to really put in an effort, and it's fulfilling not just for your practice, but it's also fulfilling to see a patient going from your clinic very happy. So that's very fulfilling for us, and that's a real reward of doctors' practice. So now let me ask Dr. Kaushik his view. Supposing a patient is very upset, shouting, and maybe in the ward or in the ICU or in the OPD, and you think that the patient is too emotional, and this patient needs to calm down, needs to cool down, but they're shouting and they are not going to be able to decide on insulin or OHA or antibiotics or amputation for a diabetic foot or whatever. So how do you handle that situation? What are your thoughts that come into your mind?
First of all, I would try to understand the situation by what Dr. Prasun says, that listening to the person intently and understanding the background of the person, where from he or she is hailing, and what is his or her mental state, and what can be the reason that he has, so to say, flown off. If we can address that problem, the initial problem, and put him at or her at ease, that this is not something that you need to really worry about. We have got something more to concentrate. These are the issues that probably needs to be taken care of at this point of time. And if we can do it justifiably, correctly, then probably everything will be okay in a short period of time. So it is better that we have to place ourselves on the shoes of the person concerned. Probably that makes it much easier to handle the situation.
I think that's an important part. Dr. Prasun Deb, over to you.
Yeah. The
You could
same
also
situation.
ask this one little
Sorry.
answer also, which you need to, the question of patients with poor adherence and poor self-care behavior, how to handle them. So
Right.
over to you.
I think both are linked. The previous situation that you described, these are the patients who will be, not very compliant. They are going to miss visits because they are anxious, they are angry. And I find that the important thing here is to break up the problem for the patient from the patient's point of view. Now, this patient has badly controlled diabetes. He's overweight. He has a bad infection on the foot. He's running a fever. The reports are all over the place. If you deal about this patient comprehensively and try to address all the problems, you are not going to help the patient's mental status. So a good way to do it is to break it up into small things. Find out whether the patient is missing tablets and say for the next week, you are not going to miss tablets. easily done. Tell the patient to have a schedule, tick the things, make sure that he is not missing tablets. This is something all patients understand. And then you talk about testing, you talk about visits, and then slowly, go to the individual components. You need to give some positives that the patient can follow easily. So tell the patient that you have to take care of your life and you have to, turn your life around. This does not work. You have to tell the patient for the next 1 week, you have to test yourself every alternate day, write it down on a piece of paper and show me that paper after 1 week. Let us see the reports and then we'll go from there. Now the patient has something to do. It's a sort of a positive feedback. Now this patient now says, okay, fine, the food is not working right now, but first doctor has said, let us control the sugar. So now he has something to do. There's a purpose in life. He does not need to worry about everything. You have to get that message through that I'm going to take care of your problems, but you have to work with me. So this is what you are going to do for the next 1 week. These are the positive steps that we need to see. And I have found that this actually works. The patient is actually proud when he brings that chart after 1 week. He says that he tells you that the sugars are actually coming down, so the tablet seems to be working. And suddenly this cantankerous and vicious patient is actually in your team suddenly. He is working with you, not against you. Just give some small positives that the patient can do at home when he's not in front of you. I think that works.
I think this is very important in diabetes because, whenever the patient comes with glucometer readings, sometimes, we just look at, अरे आपका sugar तो 200 है, ये तो 300 हो गया, कैसे हुआ भैया? आपने क्या खाया? So instead of saying that, you could first look at the good sugar values and say, oh, you've got 110 here, you got 80 there, good. Okay, I think let's look at this particular day. So I think this sort of, positive kind of approach is very good. And by the way, I must say that we have hit an all-time record today because we are usually it picks up towards the end, but we've got more than 2,000 doctors live right now. And there's a question now, which is a tough question, and maybe I'll give it to all three of you. Then the audience, the desk will ask the question, Dr. Prathyusha. This question is from Dr. Sheetal Pawar. And maybe I'll ask Dr. Kaushik Pandit to answer this very specific question. Connecting with patients causes monetary loss because patients assume that all this is going to be free advice, maybe on the phone or maybe off the cuff, or maybe the patient's bystander is asking for care. And the patient thinks, are ye so free hai, and then the patient takes advantage. So sometimes patient thinks it's free advice and the doctor loses money. In private practice, it may be a big problem. So how do you handle that issue?
Should I answer or before Chitra answer, because before she literally flies away?
Yeah, Dr. Chitra, I think he's passed the question to you, the difficult question. Doctor losing money because patient taking free advice, doctor losing money. But we have to look at these are the day-to-day problems,
Absolutely. Dr. Sheetal, that's a great question. So this is the same question you can ask yourself, saying, if I'm too kind as a person, will too many people take advantage of me? This is the same question, right? If I'm too kind to my patient, will I lose money? The answer to this is, you must have your boundaries and you should define your boundaries for yourself. And this is true not just for your professional practice, also for your personal practice. For this, you have to sit down and make a list of things which you are not okay with. Like, for example, this is something that I've learned over the years. My purpose is to treat the person who's registered for the day. And I make no comments about the family members. I used to make comments earlier. Look at the son who is obese and say, you should get your sugars tested. I have learned over the years that that is not okay to do because that he did not solicit my opinion or advice. So it is even wrong to say that. So Dr. Sheetal, the important thing for you to do is being kind does not necessarily mean that we become doormats. Being empathetic does not mean that we become exhausted because we're being kind throughout the day. That begins by establishing boundaries So you will have to put a stop there and say, this might need another consultation. We could probably meet another day and we could discuss your father's report another day. But today we are here to discuss your specific problem of the food infection. And that's okay to say that. We've never been told that it's okay to do that, but it's absolutely okay to do that. Like Dr. Prasun said, in one 15-minute consult, we cannot fix a chronic condition's trajectory, a chronic condition that has existed for 10 years in your patient. We can't change everything. That's also something which we doctors must remind ourselves, because some of the anger we feel comes from the guilt that our patient's outcome is going to be poor.
Yeah,
But that guilt is not on you. It's not on you. We are not gods. We can't change people's life in a 15-minute consult. You and I both know that we need continued care for improved outcomes in diabetes. So let go of that guilt, because that guilt is not ours. Similarly, the corollary to that story is, if your patient's HbA1c is 6.5%, that victory is not yours. You did not control the blood sugars. We did not do that. Your patient controlled the blood sugar levels, which you probably helped him get there. A ready patient controlled his blood sugars. You tell 10 people every day the same thing. Go for a walk, eat your vegetables, sleep 8 hours, manage your stress. But 5 follow and 5 don't. That does not mean you're 50% good and 50% bad. It means that 50% of your patients were ready to receive that advice that day, and the other 50% were not in the stage of receiving that acceptance. So you should go back and look up stages of acceptance of anything, of grief, any condition. We go through phases. Our job as doctors is to nudge them from one stage to another. That's all is our job, to get them to a point where they're ready to take the advice. We are not gods. We don't control lives. We don't control HbA1cs even. So we should let go of the guilt and be very clear about your boundaries, Dr. Sheetal, because we are human beings as well.
I think it's a very important question.
Thank you. Can I say a few words now? I mean,
Please go ahead.
I completely agree with Chitra about her views. I also would like to give it a different facet. Like if somebody is asking something else beyond his or her own problem, that basically means that the person is confident in your ability and you are trustworthy. That's a sort of certificate given to you. So we'll have to appreciate and sort of recognize that one. And at the same time, what Chitra said, that we must not cross our boundary, because probably that's true about the legal aspect also. We cannot, give advices for every Tom, Dick and Harry, unless each Tom, Dick and Harry asks for an advice, because that's illegal. And that violates the patient confidentiality. So that way we'll respect the person's wishes, but at the same time, we must say that, yes, probably that is something which needs to be improved. So he or she should go to the physician, or in case you find it difficult, you can definitely come back and you can discuss about this problem sometime later on, devoting some bit of time.
Yeah.
I think that's an excellent answer.
Kaushik, one small thing, what you just mentioned, the patient trusts you and therefore he asks questions. You understand that most of your patients would also bring their mother-in-law, daughter-in-law problems, and how the son is not taking care of him. Those kind of problems, you can give non-committal answers because they are not your professional opinions.
Exactly.
Once it starts spilling out over into professional opinions, there we need to be careful. We should not give casual professional advices. Giving social advices, saying that it must be something that you need to, work out and things, that's fine. But take a paracetamol is not a casual professional advice that you should be giving to any of your patients or the people who are standing around. That is absolutely mandatory.
It's against the law. It's against the law as well. Yeah.
Yeah.
Absolutely.
And also the other thing is, as the questioner asked, easy availability does not work for either the patient or for you. Easy availability should not happen. The patient should have a proper consultation, scheduled consultation for whatever 10 minutes, 15 minutes that you have scheduled, and that's it. If you tell the patient, if you have a problem, call me, then the patient will call you.
Yes.
Your idea of a problem and the patient's idea of a problem would not be the same. 202 would be a problem for the patient. It might not be a problem for you. So do not give open-ended offers. Do not say, call me whenever you have a problem. You should have a person or a phone number in the hospital where the patient can reach out to you for any problem that he or she feels. But it should not be a direct line to you. You should not be interfering with another patient's interview because you have to take a call
Yes.
from another patient. Your patient should not have direct access to you. That nursing care educator or a student of yours who is designated for this should be the person taking the call. That is something that you have to, put in
Absolutely.
writing. You say, no, I will not advise on phone. Meet me after 1 week or 2 weeks with this chart, and then we will discuss again. I tell people that you can make mistakes like this, so please don't make me do it. And that the patients understand. And that's the most safe way to say it.
I think excellent practical points by all of you. I think excellent respecting personal spaces, making sure the patient doesn't directly reach you because that might interfere care with another patient, and also your public intruding on your personal life is also not okay. Now I'd like the audience desk, Dr. Prathyusha, to take over. So before I ask her to take over, let me also ask her this question by Dr. Maheshwari here. How many number of patients actually upset doctors emotionally? So we can also get upset in the treatment of chronic illness. And your views on that. And please go ahead and now it's your turn to play moderator and ask our experts.
Definitely, sir. It happens on a daily basis. We are affected emotionally because many of the times patients, when they are not able to manage their blood sugars, or when they are not able to follow the lifestyle practices, or when they are having challenges at home, that can actually vent out on us. I can share an example to make it very clear for you. Once I had a patient who suddenly barged into my chamber that actually consultation is not meant for me. I realized it later. But he was suddenly, the opening conversation itself is like frustrating and showing anger and all. But then again, I paused for a moment, taken a deep breath, and I refrained myself from reacting. And from that space of response, I understood and I stopped for a while and asked him, why are you upset? Because there's a patient who has been waiting for a long for getting an ultrasound done. And it's been afternoon and he's not carrying his food. He's a diabetic. Hunger is the emotion which made him to show that anger. So when I applied empathy here, understanding his perspective, then I understood that that anger is not vented on me. It's actually with someone else. So when you take a pause and take the deep breath and try to understand their perspective, maybe that may not affect us. And also there was a patient who told me that I should be fine because I came 15 minutes late for the consultation on that day. He's an elderly patient. Then I was going through the conversation, taking the consultation. Then I realized that he came 15 days later. He himself told that he came for 15 days consultation later. So I got a point here. Then as I'm going through the consultation, I told him, Janab, aapko bhi fine dena hai kyunki aap bhi 15 din late aa gaye. Suddenly he started laughing, and from that anger moment it changed into a humor. So this is how emotional intelligence helps us to pause for a while, understand their perspective, and catch the little things and be always gentle at the same time firm. So definitely we can't escape patients affecting our own emotional status. We have to carry ourselves. We have to continuously put the effort to understand ourselves and our patients. That's how we can manage and not react rather than respond in all the ways possible.
Thank you. And do ask your question to Dr. Chitra first.
Dr. Chitra, do you think deep listening, understanding and paying attention to the verbal and also non-verbal communication will help us to understand our patients in a better way? And taking that little time to clarify their doubts is a practical way to put emotional intelligence into practice. That's what you think about how AI helps us.
So I think we've all understood the importance of listening and paying running on the minds of some of the doctors at least, that who has the time to spend that extra time with each patient. For that, my answer is this, that like Dr. Prasun said, and like we reiterated, we don't have to solve everything in one day. We need to pick one or two immediate points to be acted upon for that consultation. Just like we define learning objective for each learning session. You can't teach the whole of diabetology in one session. You can't teach the whole of emotional. Over to Dr. Prasun.
They are really missing you, Dr. Chitra. In the airplane. Okay, yeah. So yes, are you okay? Are you taking this up again, Dr. Chitra? I was just carrying on what you said.
Okay.
Yes. I think listening is the key. It's very important that you listen. And when I say listen, I mean actually listen, not hear. Hearing and listening are not the same thing. Just the noise of the words is not enough. You have to understand why the words are coming and why a patient is angry. And as Dr. Chitra has pointed out, fidgeting, having these body, this how do you say, postures and these things, all these things are things that you listen to. So yes, the answer is, if you can listen properly, it becomes very, very easy. And if you keep doing it all the time, it becomes second nature to you. As soon as a patient walks in, you should be able to slot the patient before he has sat down in his chair as to whether this is a patient who is very, very careless and you need to scare him a little bit, or a patient who is very, very careful and you have to allay his fears. So these are the things that you have to, in 15-20 seconds, you should be able to position your patients. Then it becomes an easy interview after that. So look at the patient, listening to the patient, this deep hearing, as you say, is very important, absolutely.
Dr. Chitra, you wanted to make a point.
One lesson which I learned from my life coach was, this was a challenge which she threw at me. She said, in the middle of a consult, we are always leaned forward, looking at the screen, talking to them, flipping through reports. She said, sit back, make sure your back is completely flush with your chair, which means you're completely relaxed. Lean back, drop everything in your hand, and pay attention to the person sitting in front of you for at least 1 minute.
Yep.
Yes. I think, Dr. Prathyusha, you can ask the next question to Dr. Kaushik.
Dr. Kaushik, what is the role of EI in counseling our chronic patients to adapt those chronic lifestyle changes, lose weight, and manage hypoglycemia? Do you think we should get trained ourselves and also get trained our supporting staff in exercising emotional intelligence while advising our patients?
We'll have to appreciate that in a team, you are the sort of team leader. So your words have got the maximum amount of weight. That has to be kept in mind. But at the same time, if the same thing is reiterated repeatedly, especially on lifestyle factors like diet, exercise, etc., and taking medications regularly, getting your tests done regularly, and looking into your results and discussing with your doctors, all these are important. If these are reiterated frequently by other people also, that becomes a very important message to persons who have never come across in such a situation. So probably that is something very important. It is also important, it is probably not important to make assumptions about what the patient might be feeling. It is important to encourage them to express their concerns. It is important that we respect their wishes about how much information they are prepared to hear. Observe and validate patients' emotions and give them enough time and space to express their emotions. But at the same time, it must be said that it is important to be truthful while doing so and refrain from peddling false information.
Well, there's a question by Dr. Ranjit Katua. So that's very well said. Information appropriate and appropriately conveyed, Dr. Kaushik. So that's a fantastic viewpoint. Question from Dr. Ranjit Katua. patient is in a hurry. You have people doing investigations and patient gets restless that everything is delayed and you have 40 patients waiting for you and the patient is shouting. Not an uncommon situation. How would you manage this situation? Your thoughts?
Uh,
I mean, yeah.
Of course, any one of you can answer. No problem.
Prasun, please.
Now, this I have had this situation, especially from people who are powerful people in their lives. Someone from the police force, for example, was shouting at our secretary because he was not let in earlier than the others. And so these are the patients whom you have to separate from the entire waiting room and deal separately, because this kind of thing becomes contagious. If one patient is shouting and if you do not intervene, soon you will have 10 other people shouting, or at least there will be antipathy. So you
Yes.
need to really, separate them. It's always nice to have a separate room where these patients can be taken, and then you can go and tell them that this is not a consultation. I'm just coming here to tell you that you'll need to wait. And for this policeman, I told him that you, of all people, should understand the importance of rules. A person who is following rules, you should not be shouting at that person. So you will have to give us a little more time. You can sit here, and when it is time, I will call you at the chamber. Don't give them an earlier consultation, because that also sends a bad message to the waiting room. So remove them, ask them to wait somewhere else, but make them wait. That is absolutely mandatory.
So I completely agree. One practical point also I find is in your team, you should have somebody who is willing to listen. So you need to identify one smart person in the reception or admin or some nursing staff or some junior doctor who's just able to listen. Sometimes you have to take the patient, like Dr. Prasun Deb said, to another room, and there somebody just listens. The patient vents it out. Everything is usually okay. Second is, like Dr. Prathyusha said, offering the patient a cup of tea. Immediately eating that food usually this happens when the patient is hungry or irritable about something. So offering a cup of tea or a snack, in that room, that will really calm things down. And it's important, like Dr. Prasun Deb said, to immediately separate. Well, I just want to add, I just got a message that we have, this is an all-time record, because I think this is a tribute to how common the problem is. We have more than 2,300 doctors watching the program live as we speak. And I think before we end the program, I just want to ask.
Now I'm stage fright affected.
Sorry?
This is stage fright. If this is not stage fright, what is?
But in a virtual setting, that's the advantage. You're not being overwhelmed by 2,300 doctors, but they're all there watching you. It's like a cricket match, and you're Sachin Tendulkar or MS Dhoni or whoever your hero is. On that note, I just want to go back to the final part, which is the Future Ready Modern SU Symposium. And I want to go and ask both Dr. Kaushik Pandit and Dr. Prasun Deb, and Dr. Prathyusha can also participate. So we have the Sachin Tendulkars and the MS Dhonis and the Virender Sehwags, or we have all these fantastic sportsmen, sportswomen. Similarly, we have glimepiride, we have dapagliflozin, we have metformin, we have sitagliptin. How do you see the future of sulfonylurea with other drugs in combination, fixed drug combination, like, for example, glimepiride, metformin, dapagliflozin, glimepiride, metformin, sitagliptin? You have used Dr. Prasun Deb, and then I'll ask Dr. Kaushik Pandit.
Yeah. Okay. Thanks, Dr. Unni. This is a question after my own heart. I really like sulfonylureas. They are powerful. And we always associate sulfonylureas with side effects, but we'll have to understand that the things that you are worried about is an over effect, not a side effect. Hypoglycemia is something that you are trying to bring down the sugar. you have overdone it. So an over effect is not exactly a side effect. A side effect is something that you did not expect. A fracture, for example, or no, the kind of complications that newer molecules bring with them. That kind of complications are not there with sulfonylureas. And that is the reason why mild to moderate everything in the body, you still can give sulfonylureas. You just need to worry about hypoglycemia. And so a shorter acting molecule like glycoside is probably a safer molecule to use in your practice. Now, the newer molecules, the safer molecules, the better molecules are all destined for one particular comorbidity. So it protects the heart, it protects the kidney, SGLT2 inhibitors, for example. Now, we now know that the GFR permission has gone down from 45 to even less than 30, and you still can protect the kidney, you can still protect the heart, but you understand that you are not producing significant sugar control once the GFR has become 20. The SGLT2 inhibitor is not going to produce significant glycosuria at that point of time. So if you have a patient whose sugar is 400 and yet has these comorbidities and you want to give SGLT2 inhibitors, absolutely you are required to give it. But don't expect the sugar to become normal with that. So you have to add something else to it. So a combination which has both an SGLT2 inhibitor and probably a short-acting sulfonylurea is not a bad deal to have. You are not giving extra tablets. You are bringing down the sugars with the SGLT2 with the sulfonylureas. You are protecting the heart and kidney with an SGLT2 inhibitor. Problem solved. And so, yes, I do not think sulfonylureas are going to go away with time. Earlier, we used to say that sulfonylureas are cheap and these are expensive. Well, now, thanks to the Indian market forces, now the newer molecules are actually cheaper than glycoside. So the cost has gone out of the issue, but still they are there. Sulfonylureas are not going to go away. So I'm sure all of you out there, all of you are using sulfonylureas. So no matter what we say, you are still going to use it. And I think that it's perfectly valid. You can continue doing that. Just watch out for hypoglycemia.
Thank you. And Dr. Kaushik Pandit, your views?
Yeah, I think each and every anti-hyperglycemics have got positives and negatives. As a good clinician, you'll have to play on the positives and try to reduce the number of negatives. The important negative in case of sulfonylurea, as Prasun said, is certainly the problem associated with hypoglycemia. And if you are a careful person, in most of the situation, you can avoid that. You can warn your patients, you can teach your patients, you can make patients more aware how to avoid hypoglycemia, what are the common situations where you will land up into hypoglycemia, and so on and so forth. At the same time, I'm also aware of the fact that each and every molecule which are required work in tandem and work synergistically. So you can add all the positives of them in one particular person. And therefore, everything is required. However bad you think thiazolidines are, we really need them. We desperately need every anti-hyperglycemic on board, and you can choose amongst them to make it the best possible combination in a single person. And I, as a person, strongly believe that non-compliance is a very big issue, not a matter of finance alone. In clinical trial, I have seen people when given free medicine or placebo, whatever, they miss to take it. So it's not a question of availability or the cost of the medication. It is the natural human instinct to forget medicine many times. So it is better if you can combine them into one tablet. That makes matters much easier, financially viable, and easily taken, so that we don't need to take it multiple times a day, multiple tablets, making ourselves think that we are having a very serious disease. Instead, we can think of that, well, I'm taking just one tablet. Actually, you're taking 3 tablets. So that makes matters emotionally intelligent to give it that way.
I think wonderfully said. FDCs make you emotionally intelligent. Dr. Prathyusha, quick thoughts, one sentence on your thoughts on FDC.
Especially when patients comes with initially high level of sugars and we are not able to convince them for insulin. That is where I look at sulfonylureas, because bringing down the sugars very fast also inflicts a sense of confidence and gives them that they can take care of diabetes. So in that way, I think sulfonylureas are very, very useful.
So completely agree, and I don't think sulfonylureas are going away anywhere. Glimepiride is there, gliclazide is there. In fact, I don't even think glipizide is going away anywhere, because glipizide is, something used in the interiors of our country and is a very, very affordable, useful drug. It's not like glibenclamide, and even that has got an important role to play in practice. Before I end, I just want to talk about how spectacular this has been. The excellent deliberations by Dr. Kaushik Pandit, Dr. Prasun Deb, Dr. Chitra Selvan, anecdotes, experiences, and excellent audience desk handling by Dr. Prathyusha. The only added point which I want to say is that in order to be emotionally intelligent, one thing you can do is to just slow down in the morning. When you come to your clinic in a very rushed manner, that sort of rubs off on the patient. So I try to be as slow as I can the morning before my OPD. Second thing is not to think too hard about the end of the OPD. As soon as you start your OPD, you may be thinking, oh, 1:30, I have to go for lunch, then I have to do rounds, then I have to do this, I have to do that. And that makes you feel a little rushed, and that rubs off on the patient. Even if you are in a hurry, you should seem to the patient to be having a lot of time. So you need to just think, slow down, I'm going to sit here, finish OPD, however long it takes, I'm going to be here. Then you will find yourself adapting to the situation and the patient better. So just two little things which I found useful, but wonderfully done, all of you. And over to Dr. Ashley. We have 2,400 plus doctors live, I'm told, which is really good, for a virtual program. It's fantastic. So Dr. Ashley, over to you.
Thank you. Thank you so much, Dr. Unni, sir. I would like to start by thanking Dr. Unnikrishnan, sir, for being such a positive host mentor, sharing your expertise, your views in such a crisp and amiable manner, and for all the analogies which you have used. My heartfelt gratitude to our expert panelists, Dr. Chitra ma'am, Dr. Prasun Deb, sir, Dr. Kaushik Pandit, sir, for enlightening us with the words of wisdom and sharing the amazing pragmatic approaches with us. Thank you, Dr. Prathyusha, for all your efforts, and dear delegates for your august presence. Words are not enough to thank my organizing committee, team members from USV and the digital team to efforts to shape for shaping this conference so well. Thank you all for making this event a successful one. All may not be mentioned, but none are forgotten. Thank you all. Good night, everybody.
Thank you. Good night. Good night.
Okay.
Good night, Dr. Unni. We'll meet.